This is one of the pieces of equipment that we use very commonly here at the hospital. It's an ultrasound machine and we mainly use it to look at soft tissue structures. It's kind of, we can use it for either the thorax, the abdomen, or looking at the limbs of the horse.
So in this horse we're just ultrasounding the tendon sheath on the hind limb. We know the horse has come in with a lameness. We put some local anaesthetic into the tendon sheath itself. The horse then became sound, so we know that the source of lameness is within the tendon sheath. So the ultrasound is a really nice imaging modality for looking at soft tissue injuries. So with ultrasound you can look at soft tissue structures, so tendons in particular. It's extremely good for imaging. And what you see when a normal tendon should be reasonably white in appearance. When there are holes or tears or damage to that tendon, you will see black areas. And as we run down at this level, we can see at the bottom of the screen, there's two white, almost sort of V-shaped structures, I guess. So that's the back of the fetlock joint itself. Yeah, on this horse, although we're not seeing any damage to the actual tendons themselves, there is some thickening of that ligament, which may be just secondary to the fact that he does have some inflammation within his sheath.
We just use them for each individual part of the horse's body. We use the straight probe for tendons, which normally run down the back of the horse's leg, and from there we can have a look at the structure of the tendon to see if there's any damage. So for example here, this would be the bone here, and then overlying the bone you've just got the tendons, and then this is skin. This is one tendon structure, this is another tendon, so this is our top tendon, so the superficial tendon. This is a deeper tendon, and you can see here we have the left fore and the right fore, and we can make a direct comparison at the same length to compare. So for example here, this tendon area is larger than this tendon area. The horse was lame in this leg, so we could conclude that there was a strain injury to that tendon, and then we can treat it as necessary. So now we are scanning the abdomen. This allows us to see kind of whether the intestines are moving, whether they're motile or not, if there's any free fluid within the abdomen, and it just kind of helps us give us an idea of what might be happening inside to be causing the abdominal discomfort that this horse is currently experiencing. Whenever we have our abdominal pain cases, so our colic, such as one that we've seen earlier, we can ultrasound the abdomen, we can look at the intestines, we can see if the intestines are moving, so are they contracting normally or are they distended. If they're distended, then that's normally an indication for the horse needs to go to surgery to have an emergency exploratory laparotomy. Okay, so we're now passing a tube into the stomach, and this is to relieve any build-up of fluid that can accumulate if there's an obstruction lower down within the intestine.
This is actually distended, dilated bit of the intestine, a really thick wall. You shouldn't be able to see this. So he's got a blockage, so everything's blown up with fluid and gas, which is why he's pain. He's got to go straight to surgery.